My name is Dano, and I'm going to be the nurse practitioner taking care of you today.
Hi, my name is Babenti. Nice meeting you.
It's a pleasure. Before we go, I just want to know whether I have your consent or have a permission from you to do the video recording while I'm taking vital information about you.
Yes.
Oh, thank you. What's your name again?
Babenti, welcome.
Babenti, welcome. Actually, I'm using my wife as my patient, and it's my pleasure that I'm interviewing you. I'm using as my patient. Thank you for taking the opportunity to do this with me.
You're very welcome.
Very welcome. So, what brings you here today?
General checkup.
General checkup. Is there any specific thing that you're looking for? Is there anything that you are concerned about that you really want to find out or you want to know?
Not really, just want to know about my well-being.
Your well-being. When was the last time you were in the hospital, if you could remember?
5 years ago.
5 years ago? Okay. Well, is there any reason why you were in the hospital?
I was pregnant to have a baby.
Okay. Did you have the birth natural, or did you have surgery to bring out the baby?
C-section.
C-section. Okay. How was it?
That's okay.
How's the baby doing now?
Great.
It should be 5 years old now.
Yes.
Thank you. Okay. So, what's your occupation? What do you do for a living?
I'm a CNA.
You're CNA. Okay. How's that going for you?
Good.
All right. Now, where do you live?
I live in Aurora.
In Aurora. Where in Aurora?
Farnsworth Avenue.
Aurora in Illinois or Aurora in Colorado?
Illinois, Farnsworth Avenue in Aurora, Illinois.
Okay, that's beautiful. How long have you been there? Long time?
Long time.
Okay, that's okay. All right. How do you get here today?
By myself.
Do you drive or somebody drop you off?
I did by myself.
Okay, that's cool. All right. What's your personal interest? What do you like doing most and things like that? What do you enjoy doing and things like that?
Reading, cooking.
Reading, cooking. Oh, that's good. That's beautiful. And cooking also. And is there any headache? Are you feeling any headache? Any history of headache today?
No.
Since you are doing a general awareness check, I'm going to be asking you this series of questions. I'm not doing a physical exam. I'm not going to touch you or anything like that. All I'm doing right now is just to obtain information about your general well-being and things like that, or if there's any potential problem or anything like that. Do you have any past medical problem like asthma, diabetes, high blood pressure, cholesterol, and things like that?
No.
No, you don't have any medical problem.
No.
Are you taking any medication right now for anything?
No.
Okay. Do you take medication occasionally for anything?
No, really.
Not really. Okay. So pretty much you are really well and healthy, pretty much. So what do you do in terms of health maintenance, like to keep you healthy and things like in terms of diets, in terms of any physical activity, like do you go to gym or anything like that?
Yeah, just walking around the neighborhood.
Walking around the neighborhood. How often do you do that?
Like a week, 2-3 times a week.
2-3 times a week. Okay. All right. What's your household? How many kids do you have?
5.
And you say you are married?
Yes.
You're married. Okay. And you have 5 kids?
Yeah.
Okay, cool. All right. You say you don't have any past medical history. So what you are here today because you want to check, you're doing a wellness check. So I'm just going to be asking you, how do you feel today? How do you feel about yourself today?
I'm good.
You're good? No, it's no headache?
No.
There's no pain, generalized pain anywhere?
No.
You're not feeling dizzy?
No.
Or you're feeling like you're going to pass out? No weakness?
No.
Okay. What about your eyes? Any blurry vision sometimes?
No.
No? Wow, okay. Any pain in your mouth?
No.
Any pain? Do you have any congestion or runny nose?
No. No.
Do you have any hearing problem?
No.
No hearing problem. So pretty much you go. Any swelling in your neck?
No.
No swelling, okay. Do you sometimes feel occasional chest pain or any? I'm not suggesting whether you have any heart disease, but I'm just saying sometimes you feel any chest pain or anything like that?
No.
No. Pretty much you are healthy. And you feel any tingling sensation or numbness in your hand?
No.
Sometimes. Or what about your leg? No pain traveling down from your back to your leg, to the calf of your leg?
Sometimes.
Sometimes.
Yeah.
How long ago have you felt that?
Like last month.
Last month? Okay. And what did you do when you felt pain like that?
Just took some pain,
Ibuprofen. Did you remember how many milligrams you took? Or how many tablets?
3. 3 tablets.
So like over the counter ibuprofen?
Yes.
Okay, 3 tablets.
Yes.
Okay. How often? I mean, when I'm like on that day, how many did you take?
Just
Did you
3
take
for the
twice,
day.
just for the three a day? Okay. And did that help with the pain?
Yes.
It relieve you of the pain. Okay. So cool. All right. Any allergies?
No.
No allergy. No seasonal allergies. No environmental allergies. No food allergies.
Just grass. I'm allergic to grass.
Grass. So that's like environmental allergies. So what kind of reaction do you get when you walk through the grass?
Itchy.
Itching. Do you take anything to treat the allergies?
Not really.
Not
Just have to get out of there as fast
Get
as
out
I
of there.
go.
So how do you avoid that kind of allergies sometimes? How do you avoid it?
And I'm walking and I step on the grass.
You don't, so you kind of use the sidewalk. Okay, that's good. At least that's good to know. All right. Also, I'm just going to be asking you, do you feel like nausea, vomiting as you are here today?
No.
No, it's no nausea, vomiting. Any difficulty urinating? Do you feel like that?
No.
No difficulty urinating. You said no vomiting, no nausea, no vomiting. Any shortness of breath?
No.
And you don't have any history of asthma. You don't, no shortness of breath. Oh, that's good. You're pretty healthy. You're a healthy woman, and that's good. Okay. So yeah. And the other thing I was just gonna be asking you, like, do you feel any pain in your throat, anything like that?
No.
No. And there is no. What about your sibling, your family member, your father, your mother? Do you know if there's any medical problem that they have?
No, not really.
Not really. Do you still have your mom and your dad?
My mom, my dad, no.
Your dad, no. When did he die? How long ago?
A long time ago.
Long time ago? What did he die from?
Just natural death.
Just natural death. So he didn't have any medical problem? Nothing like asthma, diabetes, high blood pressure, nothing like that? Wow. What about your grandparents? Do you know?
No, thing that I know of.
Nothing that you know of? When you grew up, you didn't see them taking any medication or anything like that?
No.
Not really. Wow. Yeah. Your family is pretty much healthy. Wow, that's good. All right. The other thing I'm just going to be asking you is, what do you do, like in terms of any habits? Like, do you have any smoking habits?
No.
Do you smoke? No. Do you drink?
No.
Like alcohol, anything like that?
No.
No. What about illicit drug? Do you take any drug, like cocaine, heroin, anything like that?
No.
No. Okay. So what do you take for fun? Like pop or something?
Try to drink a lot of water.
A lot of
to stay
water.
healthy.
Enough water. Okay. So the other thing I'm just gonna be asking you, do you feel like from last year up to now, do you think you have added weight in some way, or do you think you have lost weight? Do you feel like some of your dresses they can't fit you anymore or anything like that?
I had some weight.
You had some weight. So if you could guess from last year up to now, do you think you have, how many pounds do you think you have added? I'm sorry to ask you that, but just part of the thing that
10, 15 pounds.
10, 15 pounds. Yeah, okay. So how do you think, I mean, adding weight is not good because sometimes there's something they call BMI index. This is just to calculate your height and based on your weight. So they divide that. So that kind of gives us the idea to know whether you are obese or not. Obesity, it's one of the problems that can increase your cardiac problem, or in terms of people having stroke and things like that. So you want to kind of watch your weight. It's very important so that you don't, especially when people have cholesterol, they combine with weight. Having more weight sometimes can also contribute to your diabetes. And you say you don't have diabetes, so I'm just going to educate you about that for you to know that you have to pay attention to your weight. It's very important since you also come for wellness check. So this is one of the things that we're going to be focusing on and things like that. So do you have access to healthcare?
Yes.
Yes, it through your job?
Yes.
You have insurance so you can go to hospital anytime and things like that. So what do you do for diets?
Just try to take more fruits and vegetables.
More fruit and vegetables. Okay, what you say exercise, you say you walk around the neighborhood. How do you have any difficulty sleeping or anything like that?
No.
No difficulty, so you don't have to use any pill to sleep or things. What about stress?
No.
No stress. All right. So I mean, pretty much you are healthy. And what is your spiritual affiliation? I mean, So a lot of people have different belief about, because based on their religion or anything like that. What's your spiritual affiliation?
Just believe in the Bible.
Oh, so you're a Christian.
I'm a Christian.
You're a Christian. So you go to church?
Yes.
How often do you go to church?
Almost every Sunday.
Every Sunday. Okay, cool. As a woman, there is a lot of screening that people of your age, you say you are 45 years old, if I get you right? And when were you born?
December 5th, 1974.
1974. So yeah, okay. Well, all right. So women of your age, sometimes they are required to do tests like a screening to check their for cancer of different level in terms of maybe breast cancer and things like that. When was the last time you had a mammogram?
It's been a while.
It's been a while. So I'm just going to recommend that you do that screening every year.
Okay.
So it's going to be one thing I'm going to recommend after we conclude today, that you have to do your mammogram. Do you feel any lump on your breast when you take a shower and things like that? No. So like I said, it's sometimes very easy for you to check when you're in the shower. You can squeeze the nipple and things like that. No discharge coming from there? No. So the other thing is, do you know pap? Have you done pap smear? No. Do you know what pap smear is?
No.
Okay. Pap smear is another test or screen that is done to check if there's any cervical cancer. So what the doctor normally do, like a gynecologist, they try to take a sample of cell from the cervix. Cervix is more like a narrow end of the uterus in the vagina. So once they collect the sample, they take it to the lab and see if there's any traces of cancer cell. The reason why they do that early is that if they detect there's cancer cell growing, it is better to be, you have the better chance to be cured when it is detected early. So this is why it's recommended for women of your age to do the pap smear. So it's something that I'm going to recommend that you do also. What about your immunization? Are you up to date on your immunization record, like the childhood? When was the last time you had a tetanus shot? Last year. What about flu shot?
Last year.
What about pneumococcal vaccine to see if there's any to prevent you from having pneumonia?
I'm not sure.
You're not sure about that. So these are the things that, it's good that you came for wellness check, but this is the thing that is very important. As you grow older, your metabolism slow down and your chance of having infection and things like that is higher. So these are the things that it's very important for you to do. Like all the flu shot every year, the tetanus shot. It's good for your age now. It's good for every 10 years. So if you had one maybe 10 years ago, it's good. Up to now, if you have one 5 years ago, it's good. But it's recommended that you have that. But the flu shot is done yearly, and the pneumococcal vaccine is also done yearly. And that will help. Pretty much. What about your sibling? Do they have any medical problem? Your sibling, your brother, your sisters, anything like that?
No.
So you people are really pretty healthy in your family. Wow, that's a good thing to know. What else can I ask you? Do you have any question for me?
Not really.
Not really. Okay. What else? You say you're not feeling headache. No difficulty walking right now. No pain anywhere at this time. Wow. And your allergies are seasonal allergies. What is your educational level? I know you say you're doing your CNA. What's your educational level?
I went to high school.
You went to high school. Do you go to college or anything like that? Okay. What did you do?
I studied hotel management.
Hotel management. Okay. That's good. All right. Where are you from? You have an accent.
Yeah, I'm from Africa, Sierra
Where in Africa?
West Africa.
West Africa. There are a lot of countries in West Africa. Is that Nigeria, Sierra Leone, or Liberia, or where?
Sierra Leone.
Sierra Leone, that's beautiful.
Thank you.
Yeah. So you've been in the States for how long?
16 years.
16 years. That's beautiful. So have you had any surgery in the past? I know you say you don't have any medical problem, but the only surgery you've had is C-section. Any no hip replacement, knee replacement, anything like that?
No.
Any psychiatric problem, any history of anxiety, anything like that?
No.
No, you're not taking any medication for depression, anything like that?
No.
That's beautiful. Wow, that's beautiful. So I'm thinking, yeah. So pretty much we're almost done. But I'm just thinking about what is. Yeah, pretty much we're almost done. Do you have any question for me?
No, really, it was nice meeting you. Thank
All right.
you very much.
Thank you.
You're welcome.
Pleasure.